Pregnancy is divided into 3 trimesters, followed by the postpartum period. In the first trimester, many women experience nausea and vomiting, food cravings or aversions, nipple changes, and a heightened sense of smell. These changes happen as the body adjusts to rising hormone levels. During the second trimester, the baby grows rapidly. Mothers may feel round ligament pain, notice stretch marks, experience mood swings, and begin to feel the baby moving. In the third trimester, the baby's kicks become stronger. Swollen feet, frequent urination, and leaking from the breasts are common as the body prepares for delivery. After birth, in the postpartum period, mothers may have lochia, fatigue, sore or leaking breasts, and emotional changes, known as baby blues. Some may also be at risk for postpartum depression. Understanding these stages helps nurses provide better care and support. For more videos, subscribe to my YouTube channel.